থ্যাংক ইউ ভেরি মাচ প্রফেসর ডক্টর অজয় কুবাবাত স্যার। দর্শক, স্যার আমাদেরকে জানালেন আঁকাবাঁকা রোগের চিকিৎসা করে মাড়ির রোগ সারানো যায় কিনা, এবং স্যার বলেছেন যে এটি একেবারেই সম্ভব। কেননা অনেকের বনি ডিফেক্ট থাকে, এবং সেক্ষেত্রে আসলে এই অর্থোডন্টিক ট্রিটমেন্ট কিন্তু সেক্ষেত্রে এই পিরিয়ডন্টাল বিভিন্ন সমস্যাগুলোর ক্ষেত্রে কিন্তু কাজে আসে। এবং সেই সাথে আরো অনেক কিছু প্রসিডিওরের কথা বললেন, যার মাধ্যমে পেরিওডন্টাল অসুখ অনেক ক্ষেত্রে সারানো যায়। তাকে আবারও ধন্যবাদ জানাই। এবং আমি আমার পরবর্তী প্রশ্নের জন্য ডাক্তার বেনেট ফার্নান্দেজ স্যারের কাছে যেতে চাই। Sir, can we do orthodontic treatment in adult patients?
Okay, it's a very nice question. So in the past, we used to think that we need to do the treatment only if it is children and a particular age, and once we are grown up, and in adults we cannot do. But with the modern advancement which has happened, we can definitely even do, and it is recommended also to do the orthodontic treatment in such patients. So it is twofold, as like Dr. Ajay sir has very beautifully said, that it will help about in making the teeth proper such that the patient can now maintain the oral hygiene properly. So for example, if the teeth are crooked and there is a lot of defects and things like that, so that will actually stimulate. And now a lot of articles are also coming, a lot of studies are also coming where they are showing this symbiosis, this joint combination approach of perio and ortho in achieving the good patient outcomes in older patients. I'm not talking about in so that is the adult patients above 40 years. So fantastic this. The only thing we have to keep in mind is whether the patient is having systemic problems, because as age comes, because after the 40 we say that, you know, all the different diseases we like magnets attract, like all the diabetes and blood pressure and things like that. But if it is controlled, there is no contraindication, there is nothing to stop an ortho treatment from happening. And again, it all boils down to whether the patient is maintaining his or her hygiene properly, the plaque control which is being done by the patient. So, and definitely we can do the treatment, and it is recommended also. It is not like it is just like, oh, it is like that kind of a scenario, but definitely it can be done.
স্যারকে ধন্যবাদ জানাই আবারও। আমি আমার পরবর্তী প্রশ্নের জন্য প্রফেসর ডক্টর বালাজি মনোহর স্যারের কাছে যাব। স্যারের কাছে আমার প্রশ্ন, স্যার, ক্যান অর্থোডন্টিক ট্রিটমেন্ট ক্যান বি ডান ইন periodontitis?
Okay. Now we have moved from adult orthodontics to back to periodontal problems. Right. Your question is whether if some patient is suffering from periodontitis, what we call generally the common language, if we say pyorrhea. So in patients who are suffering from pyorrhea, whether orthodontic treatment can be done. Well, I would like to say that yes, we can do treatment in patients who have suffered from pyorrhea. But the basic fundamental statement over here, what I would like to say is, even Dr. Bennett has mentioned, if the patient has maintained his oral hygiene well, there is no recurrence of the bleeding on bleeding gums and all these things. And the already destroyed bone which is there has been treated by the periodontal surgical procedures. The treatment, orthodontic treatment, can be done in such patients. There is nothing like that, the bone level has reduced, so we cannot do orthodontic treatment. Many studies have been done, published all over the world, which shows that if the periodontium or if the gums and the surrounding tissues which are holding the tooth in position are healthy, the periodontal treatment can be done. So Dr. Ajay also told that orthodontic treatment will improve the dental future of the patient also, right? So only thing is, if it is a non-healthy tissue present, it will further proceed or progress the disease which is present. So once we have attained good health, healthy gingiva, healthy gums, we go ahead with the orthodontic treatment for closure of spaces or for the aesthetic purpose which is there. So it is not at all a contraindication that we cannot apply force and move teeth which have got little reduced amount of bone, we can definitely go ahead and do the treatment. Only thing is that it should be evaluated by the periodontist and orthodontist whether such health is existing and the treatment can be proceeded further. Thank you.